I'm Dr. Rishabh Tandon, presenting on rural-urban disparities in heart failure and chronic liver disease hospitalizations, a national inpatient sample study. As we know, heart failure has been increasingly causing significant morbidity and mortality in patients with chronic liver disease. Heart failure and liver disease often coexist. However, data regarding rural-urban disparities in this subpopulation is limited. We screened nationwide inpatient sample from 2016 to 2021 using ICD-10 codes to identify heart failure and chronic liver disease patients to document various in-hospital events and outcomes with a cost-based analysis. Healthcare Cost Utilization Project HCUP provided the data for NIH. The primary objectives were to observe rural-urban disparities in the clinical outcomes of these patients. We used 2013 NCHS Urban-Rural Classification Scheme for counties as derived from HCAP. The trends were assessed using discharge weights and hospital strata data provided by the HCAP. The in-hospital clinical outcomes were assessed using this weighted data to calculate adjusted odds ratios with 95% confidence intervals. For cost analysis, total charges were converted to cost to charge ratio and further adjusted for inflation. From the results, the confounders were adjusted using multivariate analysis, and we found that mortality, respiratory failure, acute kidney injury, major bleeding, acute MI, cardiogenic shock, septic shock, MCS, invasive ventilation happen more in rural population than the urban population. On the other side, acute COPD, blood transfusion happened more in urban population than the rural population. From the figure A, the counties were divided population wise. Figure B showed us that inpatient mortality happened more in the rural population than the urban population, and cost of hospitalization happened more in the urban population than the rural population. And the events that caused increased cost in these population were cardiac arrest, invasive ventilation, cardiogenic shock, septic shock, and MCS. So we concluded individuals with heart failure and chronic liver disease have a lower risk of inpatient mortality in an urban population despite higher length of stay and total inflation adjusted hospitalization charges. And certain in-hospital events were predominantly reported in rural population with worse outcomes. This study highlights the need for strategic interventions and focusing on impact of urbanization to enhance clinical outcomes. Thank you.